Hi, Frank Spanos from Empire Surgical, and today I'm going to talk to you about instability, the steps to repair it, and the products associated with it. Instability is when the humeral head goes outside of its range of motion, becoming unstable. There are two causes of instability: dislocation and subluxation. And also there are two types of tears associated with instability. There's slap lesions and Bankart lesions. Slap lesions stand for superior, labrum, anterior, posterior, running front to back, but this only occurs from 10 to 2, meaning 10 o'clock to 2 o'clock on the glenoid. A Bankart lesion occurs from 2 to 5, which means that it can happen 2 to 5 anteriorly or posteriorly. Now, when repairing the labrum, the first thing we do is the doctor puts the patient in a lateral decubitus position, which is airplaned up on its side, or beach chair, which is sitting in a chair, moving the arm freely. Usually when they have more help, like a PA, they can hold the arm with it. After they decide on the position, the doctor makes the bony structures on the shoulder. He then finds his posterior portal site by marking 2 centimeters inferior and 2 centimeters medial proximal from the posterior lateral corner of the acromion. He makes his incision and inserts the scope posteriorly. The doctor then identifies the rotator cuff interval, which is the subscap on the bottom, the biceps tendon on top, and on the sides you have the glenoid and you have the humeral head. Once he identifies the rotator cuff interval, he uses a spinal needle anteriorly to make his anterior portal incision. Once he has his anterior portal, he inserts a cannula and introduces a probe. After the probe, he then inserts a shaver or a wand to clean up the glenohumeral joint space. And at this point, we know if there's a tear or not. Moving forward into a labral tear, now that we've found the tear, the first step we need to do is use the tissue liberator to help free up the labrum off of the glenoid. Once he uses the tissue liberator, he then uses the rasp on the glenoid rim to create a bony bleed, which will help promote healing and in the healing process. The doc takes the drill guide after this and places it on the glenoid rim at 45 degrees of an angle. Once you have your angle, he can then insert the drill guide and put that in place and take your drill bit, which is, in this case, using a lupine anchor, would be a 2.9 millimeter drill bit, and you want to bottom out. Once you bottom out, you will then want to take your lupine anchor and you're going to mallet that in until that bottoms out. Once you have the anchor in, you're going to unravel the sutures from the inserter and unscrew it. Once the inserter and the drill guide are both removed, you then want to take the sutures and pull them, creating the anchor to lock in underneath the bone. And with a lupine anchor, it's a toggle lock fixation, so it looks like a shark tooth, and once it gets pulled, it's going to turn so that it cannot be removed. Once you have your sutures, you're going to use an ideal suture passer or a bird beak to shuttle your sutures. Once you shuttle your sutures, you're then going to tie knots using your knot pusher. And once again, we have two main anchors that we use when repairing the labrum. we have our lupine and our griffin. As I just discussed, we use our lupine, which is a toggle lock fixation, and it requires a 2.9 millimeter drill bit, which you have to bottom out, and the anchor itself is 3.4 millimeters. It comes single and double loaded with a number 2 orthocord, and like I said, you have to bottom out on both the drill bit and you have to mallet the anchor until it bottoms out. Then we have our griffin. Our griffin also comes single and double loaded. The griffin calls for a 2.4 millimeter drill bit, and the anchor itself is 3.0. The difference with the griffin is that there's 2 types. There's threaded and there's also push. The threaded, after you bottom out with your drill, you want to tap and then screw in, and the push you want to mallet in. And both of these differ with the anchor because you don't bottom out on these. On this you go to the first laser line. This has been the Instability and Products. Thank you very much.